Hello again, dear friends, and welcome to day 13 of our month-long adventure to rediscover your energy, strength, and self-assurance, one small but significant step at a time. If you're joining us for the first time, I'm Dr. Evelyn Blake, and for over 4 decades, I've been privileged to guide men in their 60s, 70s, and beyond as they reconnect with their bodies, not only for intimacy, but for overall well-being, dignity, and joy. And if you've been with us throughout this series, I want to take a moment to celebrate your commitment. You've already explored gentle, yet effective penis massage techniques tailored for older men on day 1. You've learned about how the aging process affects circulation and sensitivity on day 2. We discussed the scientifically proven benefits of this practice on day 3. We covered essential safety precautions on day 4. We created a peaceful, private, and inviting massage environment on day 5. We explored selecting the right oils to nourish and protect your skin on day 6. We established hygiene practices that safeguard your health on day 7. We incorporated light warm-up exercises to stimulate circulation on day 8, practiced basic massage strokes on day 9, adjusted pressure for comfort and effectiveness on day 10, and integrated calming breathwork to alleviate tension on day 11. And yesterday, we looked at how to communicate openly with your partner or caregiver about what feels good, what doesn't, and how to maintain connection and safety during massage. Now, here we are on day 13, and it's time to address a topic that many men find difficult to discuss: discomfort. Yes, sometimes, even when you're following all the right steps, you might experience stiffness in your back, tenderness in your hands, or tightness in your hips, leading you to wonder, is this supposed to hurt? Am I doing something incorrectly? That's precisely what we'll be focusing on today. By the end of this video, you'll understand why some stiffness and minor aches are common but manageable. You'll learn how to ease them naturally before, during, and after massage, and I'll share one practical, simple step you can try tonight to feel more comfortable tomorrow. But before we delve in, I'd love to hear from you. Please share your city or country in the comments below. Are you joining us from London, Ontario, Vancouver, or perhaps from a distant corner of the world? This community is filled with men just like you, kind, inquisitive, and dedicated. I'm eager to know where you're watching from. Now, let's begin with a story, a wake-up call that illustrates precisely why today's topic is so important. Some time ago, I had the pleasure of meeting a patient named George, age 72. He came into my office with a hopeful expression and said, "Dr. Blake, I've been following your massage routine. I love the concept, but I'm running into a problem." I listened attentively and asked what was happening. He explained, "My lower back feels strained afterward, and my hands ache during the massage. It's making me less enthusiastic about it." Now, George wasn't doing anything incorrectly. In fact, he was being conscientious and consistent. But like many older men, his muscles and joints had changed over time. What once felt like a simple stretch or light pressure now left him feeling sore. That moment was a turning point for George and a reminder for all of us. Massage shouldn't feel like a burden, and it certainly shouldn't leave you feeling worse afterward. This was his wake-up call, and perhaps it's yours as well. Because if you're experiencing stiffness in your hips, tension in your hands, or simply a bit more soreness than usual, it doesn't mean that massage isn't right for you. It simply means that we need to adjust the way you're approaching it. The good news is that you can easily do so with 3 simple strategies to help manage discomfort and return to the calm, healing rhythm that this practice is meant to provide. Now let's explore these strategies one by one, under the heading of managing common discomforts. First, let's acknowledge the truth. It's perfectly normal to feel a little stiff, sore, or tight when trying something new, particularly after the age of 60. Your muscles may not recover as quickly as they did in your younger years, and your joints may have lost some of their cushioning and lubrication. But please don't let that discourage you. These minor aches don't indicate that something is wrong. They simply mean that your body is communicating with you, and I'm here to help you understand what it's saying. Here are 3 effective ways to manage those discomforts and make each massage session more enjoyable. 1. Enhance your warm-up routine. If you've been following along since day 8, you already appreciate the importance of warming up. But if you're experiencing stiffness, it may mean that you need to dedicate a little more time to preparing your body. Begin with 2 minutes of diaphragmatic breathing, as we practiced on day 11. This signals to your nervous system, we're safe, we're calm. Then incorporate gentle stretches, such as pelvic tilts while lying down, gently rocking your pelvis forward and backward, or knee lifts while seated, slowly raising one knee at a time. And hand stretches, flexing and extending your fingers 10 times, which is especially important if you have arthritis. If your fingers ache before you even begin, it will affect your ability to apply those gentle strokes from day 9. A 2019 study in the Journal of Aging and Physical Activity found that just 5 minutes of warm-up activity reduces muscle tension in older adults by up to 30%. That's a significant improvement from something so simple. And remember, you're not warming up to perform, you're warming up to feel more at ease. 2. Adjust your position. One of the most common mistakes I observe, particularly among men who try to follow along too strictly, is remaining in an uncomfortable position simply because it seems like the correct way to do it. Please, don't do that. If sitting upright causes tension in your hips, lower back, or shoulders, try lying down on your bed with a pillow supporting your knees. This flattens your spine and reduces pressure on your joints. If you have a recliner chair, that can work too. Just ensure that your body feels well supported. And for men who experience wrist or elbow strain, place a pillow under your arm to avoid holding it in the air the entire time. This is particularly helpful when using your dominant hand for massage. I often say, let the pillow do the heavy lifting, not your muscles. And if you're massaging with a partner, as we discussed on day 12, simply say, let's try a different arrangement today. I'd like to be more relaxed. Open, kind communication makes all the difference. 3. Practice post-massage care. The session is over. You've completed your breathing exercises, your warm-up, and your gentle strokes. Now, it's time to care for your body afterward. Most men skip this step, but please don't. Post-massage care is how you express gratitude to your muscles for their efforts. Here's how to do it. Take a clean towel from your hygiene kit, as we discussed on day 7. Soak it in warm water, gently wring it out, and place it over any sore areas, such as your lower back, hands, or inner thighs. Leave it there for 5 minutes, breathing slowly. The warmth relaxes tight fascia and helps your body release any accumulated tension. Then stretch gently. A 30-second arm stretch or leg roll helps restore blood flow and prevent stiffness. If you experience persistent soreness, pause the routine, rest the area, and gently clean it with mild soap to prevent irritation. If the pain lasts more than a day or two, it's always wise to consult with your doctor, especially if you have arthritis, diabetes, or any circulatory conditions. These 3 simple practices, a longer warm-up, better positioning, and aftercare, are like providing your body with a soft cushion of support. When you treat your body with patience, it responds with comfort and confidence. Next, we'll discuss how to integrate these strategies into your daily routine and your one small action step for today, making discomfort management practical. Now, let's be honest. Knowing how to ease discomfort is one thing, but actually implementing it every day is where most men struggle. And I understand. Routines can feel overwhelming when your body isn't cooperating or you're already dealing with stiffness. That's why I've designed this program with real-life seniors in mind. No fancy equipment, no gym memberships, just small, consistent actions that protect your joints, support your circulation, and make your massage practice easier to maintain. Here's how to incorporate all of this into your daily massage space. Whether you're doing this alone or with a partner, Step 1. Upgrade your warm-up tonight. Before your next massage session, dedicate 5 minutes to preparing your body. Here's what I'd like you to do. 2 minutes of diaphragmatic breathing. Slow inhale for 4, slow exhale for 6, as we learned on day 11. Then, 1 minute of gentle pelvic tilts or leg extensions, especially if you feel stiffness in your hips or back. Finally, 1 minute of hand stretches, flexing and extending your fingers 10 times to ease any arthritis or tension. Keep your hypoallergenic oil nearby from day 6 and sit on a towel for comfort, as we discussed on day 7. This entire process signals to your body that we're easing into this, with no rush and no pressure. Step 2. Adjust for comfort, not perfection. There is no perfect position. The right position is the one that feels good to your body. If you notice tension in your lower back while seated, lie down on your bed or sofa. Place a small pillow under your knees. Use a rolled towel under your neck for comfort. If you notice your hand getting tired, support your arm with a cushion or folded blanket. Alternate hands if needed. Take breaks. This isn't a race. And if you're massaging with a partner, use open communication from day 12 to say, let's try lying down today, or, can I pause to reposition? This small adjustment could be the key to transforming discomfort into relief. Step 3. Care for yourself after your session. Don't skip this. After your massage, take a clean towel, soak it in warm water, and wring it out. Lay it over your hands, lower back, or pelvic area for 5 minutes. Then do a light stretch, arms overhead, or gentle leg rolls. If you feel a sore spot, pause the routine and rest the area. You can always resume it tomorrow. You can even jot down a quick note in your phone or notebook. Felt stiff in left hand. Stretched before and after. Felt better. Keeping track helps you understand your body's patterns and respond with kindness. Your action step for day 13. Tonight, I want you to try an extended warm-up. Here's your step-by-step guide. Go to your cozy massage space from day 5. Sit or lie down comfortably. Do 2 minutes of belly breathing. Then do 1 minute of hand stretches. Add gentle leg movements if needed. Afterward, notice how your body feels. Do your hands feel looser? Is your back more relaxed? Just reflect. No pressure, no judgment. This small step prepares you for day 14, when we'll discuss how to make your massage habit consistent, even on days when you feel tired or distracted. You know, when I first began guiding older men through massage routines, many of them felt ashamed when their bodies didn't respond perfectly. They'd say, "Dr. Blake, I feel stiff. My fingers cramp. Maybe this just isn't for me." But here's what I always tell them: you are not broken. Your body is simply asking for patience. I remember George, the man I mentioned earlier. When he came to me, his enthusiasm was high, but his comfort was low. He almost gave up. But once we added simple changes, warm-up stretches, lying down instead of sitting, using a warm towel afterward, it changed everything. 3 weeks later, he came into my clinic smiling and said, "Doc, I don't dread it anymore. It feels good. It's something I look forward to." And that's the transformation I want for you as well. You are not alone in feeling stiff or awkward or unsure. This is a learning process. This is your body saying, "Hey, be gentle with me. I'll open up. Just give me time." That's why we proceed step by step in this 30-day journey. You're building awareness, trust, and strength, one breath, one touch, one habit at a time. Looking ahead to day 14 tomorrow, we're going to build upon everything we've learned so far: the breathing, the warm-ups, the pressure, the communication, and discuss how to make this a consistent habit. Because the truth is, true healing doesn't happen in a single day. It happens when you show up again and again, even when it's not perfect. Let's check in. Take a moment with me now. What's one part of your body that feels better after today's session? Did adjusting your position help? Are your hands or back a little more relaxed? If something helped, leave a comment below. Type 13 if you're ready for day 14, or share one thing you did today to ease discomfort. Your comments inspire others in this community. They demonstrate that we're all walking this path together. Discomfort is not a signal to stop. It's an invitation to listen, to adjust, and to treat your body with more care. And today, you've learned how to do just that. You're not just massaging your body, you're rebuilding a relationship with it. A relationship that affirms that you're still worthy of care, you're still capable of healing, and I'm here for you. So, carry this energy into your evening. Get comfortable. Try that warm-up tweak. Let your body know you're on its side. And when you're ready, I'll be here waiting for you on day 14. How to stay consistent. Hit that subscribe button, tap the bell, and let's continue building your path to vitality. I'm proud of you. See you tomorrow.